So we've been talking a little bit about cortisol recently, and I want to talk about some simple steps that you can take to help control your cortisol. Now, of course, finding the root of stress and the reason why your system is dysfunctional is always the best thing you can do. But I always want to also give you a few little ideas of how you can control this yourself, things that you might be able to do yourself. But again, remember that these things are very broad, and really you really do probably need a proper investigation if you're having cortisol issues to work out why you may be having your issues. Alright, so we've broken down to 3 different things in terms of lifestyle, nutrition and supplements that you can take that might be able to help you. Before we get into this though, I need you to understand exactly how cortisol functions in the human body. So about 30 minutes after you wake up in the morning, so somewhere around this area here, about 30 minutes after you wake up in the morning, your cortisol levels peak for the day. So they come skyrocketing up in the morning, and this is what gives you your wake up. This is what gets you your get up and go in the morning, or at least a big part of it. So if we don't get that cortisol shift in the morning, which can sometimes happen from things like sleep apnea and the like, we don't get that wake up, and these are the people that often need caffeine to get themselves initiated and get their energy levels up in the day. So we should have this spike that comes up first thing in the morning, and that should progressively come down. We show there's like a little flattening period here around 3 or 4 o'clock in the afternoon. If we don't get that, that's our classic 3:30itis that so many people feel. So this is a little bit of flattening through there, and then we should keep going down until we get to nightfall, where the system needs to calm down. Another hormone called melatonin needs to come up to allow you to actually get to sleep. So what can we do about this if we've lost this rhythm, or our levels are just too high or too low? Of course, we've got pathological levels and we've got functional levels. In this case, what we're really talking about is functional levels. We're not talking about Cushing's or Addison's disease in this regard. So, key things. So from a lifestyle perspective, the first thing we want to do is we need to establish a routine. And it sounds really simple, but it's actually probably one of the most significant things that you can do is to establish a good routine. And what we're really talking about here is lifestyle routine. So we've got 2 types of routines we have. One is habitual, and the other is lifestyle. So what do I mean by this? Habitual routines are which hand you brush your teeth with, which hand you comb your hair with, which direction you drive to work, all those things that you do day in, day out that are just kind of on autopilot. The more you vary them up, the more stimulation that you get right across the brain and the healthier it is for you. When we're talking about lifestyle routines, we're really talking about the basic things of life. So what time do you get up in the morning? What time do you go to bed at night? When do you have dinner? When do you have breakfast? When do you do your exercise? All of these things ideally need some level or some form of shift in hormonal and neurological function in order to maintain yourself. So for instance, if you're always going to bed at 9:30 at night and you're always waking up at 7 a.m. in the morning, then the brain already knows what time it needs to start initiating these responses, and it seems to reduce the stress in a lot of people. Okay, it's not going to completely normalize your cortisol on its own, but it does make a huge difference. So our morning routine, night routine, these are the real key things that we want to be looking at when we talk about routine. Aerobic exercise is another really important one. So we're talking about cardiovascular exercise that is of a low intensity. So this is really important as it elevates a hormone called brain-derived neurotrophic factor, BDNF. And BDNF is critical because it stimulates the growth in an area of the side of your brain, your temporal lobe, called your hippocampus. And as BDNF levels come up, we get stimulation, we get growth in those areas. And this is one of the key areas that's responsible for turning off stress responses. Okay, so it's a really critical thing. It does wonders for people with emotional disorders such as anxiety, depression, these type of things as well. And one of the key things that is often forgotten is downtime. So what do I mean by downtime? Downtime doesn't mean sitting on the couch with the kids playing a game necessarily. Downtime means time to yourself. It's time for the brain to reboot. And this is where so many people have struggled during the whole COVID crisis, is not having that downtime. We're seeing more and more people who are high achievers now struggling with this lockdown process that we've been going through, simply because the fact that their ability to recover from day to day has been removed. All the things they normally do to get downtime, whether it be going swim in the morning, going out for drinks on a Friday night, riding a bike on the weekend, whatever it is, that they reduce the input into their brain and allow their brain to just vegetate and just switch off, or meditate, if that's the right word you want to use. All these things seem to have disappeared. These are the things that disappeared during a lockdown process. So downtime is really critical, and it's time to just do what you want to do. Time on your own, time to just unwind, which is really critical. From a nutritional perspective, a few key things that we can do along here as well. So a couple of things. So first one is make sure you're eating frequently. So all of these things, both this and our dietary shifts that go with that, both these things are associated with trying to negate the effects of hypoglycemia. So quite often when people have stress-related responses going on, they can't maintain their normal blood sugars. So when the sugars drop really low, it's cortisol gets released to help them come back up, initiate what we call gluconeogenesis. So we need to get these blood sugars back up, and the way we do that is through cortisol. So every time we drop down low, the result of dropping down low constantly is the need to initiate cortisol or stress responses over and over and over. So we want to mitigate that. So we want to be eating a little bit more frequently, increasing the amount of fat in our diet and slightly decreasing the amount of carbohydrate, especially refined carbohydrates in the diet, just to allow the system a chance to recover and heal during that time. If we can't do that, sometimes having some water in which you put a little bit of manuka honey and perhaps some lemon into and sipping it constantly through the day can also help maintain that blood sugar process and stopping us from dropping into hypoglycemia. Okay, supplements. So these are things, whenever you're looking at supplements, you really probably need to be assessed and checked to make sure you're not going to have any interactions or allergy responses or things like this to these type of things. But there's a couple of key ones that you can use here. Phosphatidylserine is a fat that's used to stabilize membranes, especially in the brain. It's a key substance, especially within the hippocampus and in that area we spoke about that negates stress. So we know that phosphatidylserine has been shown to lower cortisol levels and help stabilize cortisol levels. So it's a nice little supplement that can be used in there. Rhodiola is an awesome herb which is known as an anxiolytic. It helps reduce anxiety. The other key thing rhodiola does is it stimulates growth in the hippocampus, and it also helps control estrogen responses in the limbic system. In other words, it helps control anxiety emotional responses, which can help calm stress. And this is a key thing that we've used quite commonly with people who are suffering anxiety. It really tends to help them control their stress mechanisms and just get through the day a little bit easier. Cordyceps is a cool little mushroom. It's grown at high altitude in an oxygen-deprived environment. It does so many different wonders for the human body. It increases aerobic function, increases Krebs cycle function, improves adaptation to environmental stresses. In fact, there's been a couple of studies now done on athletes that have gone to high altitude and trained and shown that it improved the blood work and improved their rates of recovery. Cordyceps is also a supplement for those of you who remember the World Swimming Championships back here in 1992, where the Chinese women were coming out with these massive shoulders and everyone's thinking they were on drugs and all this kind of stuff. Really, they were the real first group that's been documented being using cordyceps, and it wasn't that it causes this enhancement in their size. It's more so the fact that it just allowed them to recover quickly and allows them to train more. But cordyceps also increases substances like BDNF and glutathione and all these substances that are responsible for helping brain health and helps control stress. So it's a really awesome adaptogen, helps normalize immune function as well. And then our chlorides. So our chlorides are things like sodium chloride, potassium chloride, magnesium chloride. So probably a key one that we want to use here is magnesium chloride. So the chlorides are responsible for or help in the production of pregnenolone. So as we ramp up pregnenolone, it increases the stores for our precursors, which helps produce cortisol and our other steroidal hormones, which can help people get through things. And one of the reasons, I should say there isn't, but one of the reasons why a lot of people will start craving salt when they have an adrenal-based problem or a cortisol-based problem as well. So anyway guys, there's a few different things you can do, some lifestyle things, some nutritional things, some supplements as well to get you started and trying to regulate your own stress levels and try and start getting your cortisol levels under control. Remember, please don't go down the path of taking anything or making any major changes without being properly checked. If you need some advice before you go down that path, just send me a message. You can hit me up on Facebook, you can DM me on Instagram, send me an email, or just give me a call at the office. Whatever works easier for you. I'm always happy to help out in any way, shape I can, and get you whatever information you need to try and get your life back on track. Anyway, guys, if you have any questions, post them up or send me a message. Otherwise, remember, it's all about adding life to your years, and we'll catch up with you in the next vid. See you guys. Bye for now.